So thanks for coming to today's information session. I'm Shelby Stanley. I am the program director for the Ophthalmic Technician program. This is an associate's degree program here at Elgin Community College. This is all of my contact information, and then I'll have it again at the end too. So first, let's talk about ophthalmology. It's the field of medicine concerned with the anatomy, diseases, and treatment of the eye. Ophthalmic technicians work with eye doctors, that's ophthalmologists and optometrists, to provide medical and surgical treatment of eye conditions. So I like to say that kind of like a dental assistant or a dental hygienist would get you ready to see a dentist, I would get you ready to see an ophthalmologist. What do? We take health histories from our patients. We perform a lot of diagnostic testing, everything from just checking vision to using state-of-the-art imaging technology. We can use infrared to scan the backlining of the eye. We can take pictures of the inside of people's eyes. I have measured people's eyes before cataract surgery. Some technicians also scribe, which means we work alongside physicians to help them document their findings. Many technicians also assist in therapeutic or surgical procedures. So that's something that if you really like that, there are definitely practices where you can assist in in-office surgeries. But if maybe you want to get into something in medicine, but you don't really like all of the really invasive procedures, there are actually plenty of great job opportunities in being an ophthalmic technician where you wouldn't have to do anything invasive like that. Not a fan of needles and blood, that's okay. If you I assisted with surgical procedures all the time because that never bothered me. And we educate patients and help our communities. It's a field with a lot of daily variety in our work, which I find very rewarding. I'm also somebody who really likes solving puzzles. So I really liked that even though we have, say, standing orders from our physicians that tell us, what we can do. Oh, hang on just a second. I'm going to let somebody in here. So even though we have standing orders from the physicians that say what we might do in certain situations, we get to make a lot of decisions and say, okay, what is the patient telling me? All right, then I should do this and this and this to get all of the information my doctor needs to correctly assess, to diagnose and treat their patient. So what is the profession like in the very broad sense? Well, we usually work in private clinics. Some work in hospitals or in research settings, but in general, because we're in private practice clinics, most of the positions are weekdays. There are very few nights or weekends. At my previous position, I worked one weekend a month, which it ended up being one half day on Saturday, once a month, which is really not bad. Continuing education is necessary to keep our certification, which I'll tell you a little bit more about in a minute. And most employers do pay for continuing education. Some of the things that we have to be able to do this job: you need to have fine motor skills, ability to use small instruments. You do need to be able to stand for long periods of time. Our job is a lot of walking around. You definitely get your steps in. Most shifts are 8 hours. You may work somewhere where you have the opportunity to work 10 to 12, but that would be entirely up to you. But a lot of your shift you're going to be walking. You need to be able to support 30 pounds of weight. Generally, we aren't lift trained, but that's something that your employer should tell you and train you on. So in the program, you will not be expected to lift a patient, but you may need to assist them into a chair. You do need to be able to see well far away and up close. We assess patients' vision. So to be able to do that, you do need to be able to see yourself. You need to be able to tolerate sights, sounds, and experiences interacting with varied patients from different backgrounds and with different medical conditions. So even though we are looking at people's eyes, a lot of what you're seeing, diabetics, for example, have a lot of, can have eye problems, and they can also have, say, renal problems. You may be interacting with somebody who has a colostomy bag. You may be interacting with somebody who has an amputated limb. So those are things that you have to be aware that you're going to see in day-to-day clinic. You do need to be able to speak and write English and use a computer for medical charting. A lot of our data input, how we communicate to doctors nowadays, is through electronic health records. So using a computer would be big. Our certification. So we are certified through JCAPO. It is the Joint Commission on Allied Health Personnel in Ophthalmology. And this program actually prepares you to sit for the Certified Ophthalmic Technician exam, the COT. The COT is actually the intermediate level of certification for us. So doing this program, you would bypass basic certification and be able to sit directly for the COT exam. This is really great because if you look around the area, if you talk to the practice administrators around here, a lot of them hold a COT certification. So this certification is where a lot of people end up stopping in our career. Not a lot of people have their COMT, which is the advanced level of certification. However, if you really feel passionate about this career and you're somebody who likes to continue their education, a really unique part of our career is when you have worked for a certain number of hours as a certified ophthalmic technician. So you've passed the test and you've worked as a COT for a while. Your place of work can actually sign off and say, yes, they worked with me for this many hours. And you can apply to take the Certified Ophthalmic Medical Technologist, or COMT exam on your own. The job outlook is phenomenal. Everywhere I go to try to set up all of our clinical sites, they ask, how soon can you have technicians for me? The US Bureau of Labor and Statistics expects a 14.3% increase in ophthalmic medical technician jobs this decade, which is very good, even within all of the health fields, which are all growing. The BLS reports an annual mean wage nationally of $41,000 as of May 2021, and the mean annual wage in Illinois was $43,000 to $56,000 as of May 2021. And keep in mind, when the BLS, when they tally all of this, they actually don't take into account everybody's level of certification. So this is everybody, including that basic level of certification. And I've never encountered an employer who didn't give a pay increase for being a COT rather than a COA. The admissions requirements for our program: you do not have to have any college coursework per se, but you do need to show that you're college ready for English, reading, and math. You can do that either through your high school coursework, or if you've taken any college courses already, or standardized tests like ACT or SAT scores, or Elgin Community College's placement exams in those three areas. So a good way to find out if you meet those qualifications is to submit your transcript and ask ECC to evaluate that transcript. And our academic advisors are fantastic. They can help you plan out really everything. Our academic advisor, who does a lot of the health professions, though not all, so if you worked with somebody else, don't worry, they're all wonderful. But Sarah Buzelli works with a lot of health professions students. So if you have any questions, I would definitely refer you to her. And you do need to, of course, apply to the college, which, remember, is free. So if you haven't done that yet, I would highly recommend it. And for any of the health professions programs, you do need to submit the health professions application, which you can find online, or if you do talk to one of our academic advisors, they can guide you toward that health professions application, which is also free. The specific program requirements, all of the health professions programs have some health requirements. Ours, you do have to do a background check and drug test, which will be guided through the Castle Branch software, which a lot of the health professions use. COVID vaccination is required for all ECC health profession students. Proof of up-to-date immunity to measles, mumps, rubella, and varicella, which is chickenpox. So up-to-date immunity means either a very recent immunization or you have to titer. So you have to have them draw your blood and see, do you still have immunity to these? If you don't, then you may need to get a booster. And also up-to-date Tdap, which is tetanus, diphtheria, and pertussis. Proof of immunity to hepatitis B, or if you prefer, you can sign a declination of hepatitis B immunization. Personal medical history form signed by your healthcare provider. So that's medical clearance saying that you are healthy enough to do the program. Can you walk around? You're not gonna, have other health problems that your physician or like nurse practitioner can foresee because you're doing the things that we do in this program. An annual flu vaccine, annual tuberculosis testing. We do need CPR for healthcare providers. If you need help with that, you can search on the Blue Cross Blue Shield or the Red Cross website, or I can help you through that. And valid health insurance throughout the duration of the program. So approximate program costs. Castle Branch, which was that software that guides you through all of the uploading your proof of immunizations and has the background check for you to do, that's about $118. CPR certification, depending on where you get it, is about $35 to $65 per class, usually. Do make sure, again, that your CPR certification is the healthcare provider CPR certification. Enrollment fee for anywhere in the college is $6 a semester. The ophthalmic technician courses in particular, for in-district tuition, it ends up being $5,082. We have 2 textbooks, they are $154. Supplies, of course, those are going to vary by what you want, but books are your like pens and paper and all that stuff, probably about $100. Uniforms, you do need uniforms, and we'll talk a little bit more about the expectations of what you need to wear in clinicals. I personally like to have a couple so that I can wash them in between my clinic shifts. So I just kind of put a total on here for something kind of reasonable, but you can decide what works best for you. Uniforms are available in the bookstore. So 2 pants, 2 tops, and 1 scrub jacket would be about $180. You do need shoes appropriate for clinic. Appropriate for clinic just means that they are clean, they have closed toes, and they do have something to cover your heel. So no Crocs. And of course, if you want $500 shoes, go for it. The COT certification, even though you get to sit directly for the certification after you go through a program like ours, you do still have to pay Jacopo the same certification fee. It is $325. So approximate total, $6,108. General education classes. If you have not taken any general education before and you don't have any of those credits to apply, our course load, which I'll get to in a moment here, Ends up being 24 additional credit hours. So with the in-district tuition, that's an additional $3,168. Gen Ed textbooks and supply costs. I can't tell you because I don't know exactly what class you're going to take. If you do not titer as immune and you need required vaccinations, the out-of-pocket cost for that varies greatly depending on what insurance you have. It could be a total of $750, but that's if you need all of them, which would probably be pretty rare, but I don't want you to be surprised by that if it does happen. So all of this, I know that seems like a lot of big numbers. We're actually fairly low for all of the associate's degree health professions courses. But remember, please, please, please talk to our financial aid department. They're wonderful. They are there to help you. So please see if any financial aid is available for you. That was a lot of numbers and a lot of boring slides. So here's my cat. She was very, very frustrated to be in this costume and I have to shame her every time. Oh, I see a question. You want to come on and ask the question, or did you put something in chat for me?
Nope, I can ask you the question.
Yes.
So as far as can you go back to that previous slide? I think you just shared where the courses.
This one?
No, the one that actually lists like the classes you have to take.
Oh, yeah. Yeah, that's the next one.
Yeah, there it is. Perfect. That one. Oh, is that oh, I'm so sorry. Were you done with the presentation? Because you're not.
Oh, no, we're going to go into this next. So if
perfect.
you have questions about classes, I'll do those next.
Actually, let me ask you something about the slides you really already shared. So one of my questions is this. You mentioned that you have to have like the English, reading, and math, but then also fill out the application. Like how many seats are available for students? I mean, like how competitive is it to get into this program?
So right now we do still have seats remaining. We will admit a maximum of 20 in the first cohort. So will it be competitive? Time will tell for that, but there are seats remaining right now and it is rolling admission. So until seats are filled, I will continue to take applications.
Perfect. Thank you.
Of course. Any other questions?
Nope, I think I'm good.
Okay. So this is the course sequence. This is the first year. So fall semester, you'll be taking 2 ophthalmic technician specific courses. That's 101, which is the Intro to Ophthalmic Tech, and 110, which is Principles of Ophthalmic Tech. 110 does have a lab component. Bio 110 is the required biology course, and English Composition 1. Spring semester will be a continuation of our principles class. So 120 is Principles of Ophthalmic Tech 2, and you'll start your clinicals. So clinicals, you'll actually be going out into clinics in the community to gain experience with real patients under real ophthalmologists. So this is where that begins. You'll take anatomy and physiology and your next English composition course. Year 2, it's a continuation of our Principles of Ophthalmic Technician. We'll build on skills, get a little bit more advanced. You'll have your second clinical. Going back to year 1, it will be 1 8-hour day a week, your first semester, which was here in the spring semester. And then coming here to fall semester, which is your second clinical, it is 2 8-hour days a week. You'll have your second anatomy and physiology class. To get the associate's degree, you'll need to choose a social behavioral sciences course. And then the spring semester, we have Principles of Ophthalmic Tech 4, which is some advanced skills, building on those, and also reviewing so that you feel prepared for the certification exam. And also your last clinical rounds, that will be the heaviest clinical rounds. So it will be 3 8-hour days a week. And then there is the liberal education requirement that is part of the associate's degree requirements. So like I said, clinical rotations, the very first semester, we do want you to know what the profession is like. So there's a more flexible 1 8-hour day shadowing. So you're just gonna go to clinic, see what it's all about, what technicians do, what the ophthalmologist does, see what the clinic flow is. Second semester, like I said, 1 8-hour day a week. There are no ophthalmic technician classes over the summer. Of course, you can take gen ed classes. So you can work with an advisor, and if you are somebody who would continue working through school, this may be a way to reduce some of that course load while you're still working toward your associates. But be able to kind of make that work-life balance a little bit better. Third semester, 2 8-hour days, and fourth semester, again, is 3 8-hour days a week. So you'll be placed in these clinical rotations to ensure access to as many clinical skills as possible. We want you to be prepared. That's the whole reason you're coming to us, is to be prepared for this career. So we want to get you into good clinics who are going to teach you a lot and let you see and do a lot. Rotating through different clinics will allow you to see a lot of different perspectives. All doctors are different. You'll see a lot of different technicians who've had different backgrounds and are great at certain things. And it might give you an insight on the local job market. A lot of technicians who come out of programs, they're offered a job basically the day they step out of a program. But because we do need to complete these clinical hours as part of you getting to that COT exam, attendance at all clinical days is required. Quick dress code overview. The scrubs are this Caribbean blue color. They can be purchased through the bookstore, and they'll be worn to each clinical day. There's an ID badge that you'll get through Student Life. Shoes, again, flat heels, closed toe, and a back on the shoe. So any like tennis shoe, running shoe, that kind of thing. Pull back long hair. Fingernails, no further than a ½ inch past the fingertip, and no pointed manicures. Remember, we're going to be really close to people's eyes. So even though I think those nails are beautiful, it's just not something that's really considered appropriate by a lot of our clinical partners. No strongly perfumed or scented products in the health professions. That's just something that you should keep in mind with any patients that you're working with. And wearing jewelry is discouraged. Avoid dangling jewelry. If you have something that has to be worn, I understand. But simple studs in your piercings, flat bands, that kind of thing, because gosh, I'd hate for you to like lose a stone out of a ring or that kind of thing. We have a brand new space being built for this program. It is beautiful. It's up on the 3rd floor of Building A, which is where all of the health professions programs are. It is going to have 2 fully functional exam lanes. So that's what we call our exam rooms, lanes, 2 specialty testing rooms, and they are all filled with state-of-the-art equipment. I am very excited about all of the things that we are going to have available to us to use. So I said that I would have my contact information again, and here it is. I'm going to actually stop the recording here.